Our hospital is just in crisis. It is bursting at the seams.
Inside the Abbotsford Regional Hospital, doctors are sounding the alarm. In one ward,
the nurses are changing patients and exposing their genitals as the general public are walking by because they don't have privacy walls.
Doctors say the worst congestion is in the ER and other medical wards where patients need complex care. So what is going on? Would you say this is compromising the dignity of patients?
You know, we're certainly trying to optimize every single space.
Dr. Michael Newton is an ER physician with 32 years of experience in Abbotsford. He credits staff for doing their best, but congestion is the worst he's ever seen.
Patients crowded into a small cubicle with no privacy, patients having no option but to use a commode or to go to the bathroom in front of other patients. My number one stressor right now is seeing patients that are being cared for in areas that were never designed for inpatient care, out of necessity.
Data from the Ministry of Health shows the largest hospital in BC's Fraser Valley has been operating at 128.4% capacity for 2023-2024. And that's more than any neighboring hospital, all of which are over capacity. Dr. David Liu is the medical director for the hospital. Would you say the concerns that your colleagues have talked to me about are valid?
Yeah, you know, I'm not discounting those concerns. They are valid concerns, and certainly we have significant demands as a result of many complex issues. So there's certainly legitimate concerns.
One of the biggest issues that doctors note in this hospital is just how long patients are spending in the ER after they are admitted. Data from the Canadian Institute for Health Information found that 90% of admitted patients this year spend up to 114.9 hours in the ER, almost 5 days, which jumped from 87.2 hours in 2019. Now, doctors say these long stays in the ER are particularly hard on the elderly.
If they're not confused when they come in, they certainly end up confused often after a few days because of the environment that they're in. And we know that patients that develop delirium often end up with a prolonged hospital stay or a poor outcome.
Fraser Health says there has been an ER expansion in Abbotsford, but doctors say that expansion hasn't solved the problem.
Patients have to go somewhere. We can't send people home when they're needing hospitalizations.
Dr. Susan Cooper has worked in the hospital for almost 15 years. She says over the last year, up to 100 patients at a time are being left in stretchers in the emergency and medical wards.
Never would I've ever expected that it would come down to this.
Dr. Cooper says one of the busiest medical wards often has up to 15 patients in the hallway since May.
As there's no electrical outlets in the hallways and the extension cords are coming out into the hallway, we don't have the equipment, like we're using portable oxygen tanks.
I know the work environment's quite challenging with the increased demand in terms of the patients, the number of patients that are presenting to hospital, and certainly the increased rates of hospitalization that we're seeing. We're trying to make do with every single space that's available to us.
Fraser Health says when patient volumes are exceptionally high, it may use alternate care spaces, such as hallways, vacant surgical day beds, and outpatient areas to help meet that demand.
Those that have life-threatening disease, we need to find capacity for those, and those will get priority. And unfortunately, it means putting some patients in the hallway.
Doctors say there's not enough beds or physical space in the hospital to keep up with a growing and aging population in BC's Fraser Valley.
I think our hospital is unique in that the crisis is so much more pronounced and so much more visible in every way that it's hard to ignore.
Fraser Health says in total there are 275 acute care beds. 28 have been added since 2016. But the hospital is dealing with an average of 347 patients in acute care beds at any given time. And the province says another big reason for high occupancy is patients who no longer require hospital services but are waiting to be admitted to another care facility or need more support after they are discharged. There's also continuing staffing challenges. Fraser Health says it is taking action. A $30 million investment in the hospital and the addition of 236 full-time staff. Plus, a new long-term care facility will add 91 new beds, which will free up more acute care capacity. It's also looking at more expansion strategies.
And we're certainly trying to build capacity, and we're certainly trying to improve the work environment for the physicians and the staff at hand, and in particular the patients.
Doctors say they still have pride in the hospital and their colleagues and want to see their concerns taken seriously faster.
How do you stop squeezing us for any more, because you can't squeeze more than 130%?
People in Fraser East are suffering.
A call to put patients first in a complicated crisis that isn't slowing down.